Yeah, so generally speaking, the patient becomes not contagious 10 days after the beginning of the onset of symptoms, so long as they don't have symptoms of a fever within those 24 hours. So clearly he's still in the contagious period, and so if he's going to be around people, he needs to be cognizant of that and wear a mask.
Now, we don't have the exact information regarding his medical history the last couple of days, but we did hear from his doctors. Most recently this afternoon, they said he didn't have a fever. His oxygen level seemed okay, but he is taking a lot of drugs and was diagnosed a few days ago. Based on what you do know, what can you tell us about his condition?
Well, first off, remdesivir was one of those first medications that was given emergency use authorization by the FDA. Initially, it was for people who were only on oxygen, and that was expanded. So I wasn't too surprised to see remdesivir started. Also, the Regeneron's medication with the antibodies. What was a little more puzzling to me was the use of steroids in this case, because that's generally reserved for patients who are on oxygen and who have pneumonia. I noticed that his doctor, Dr. Conley, was a little evasive and said that his CT and X-ray findings were what was expected. So I'm assuming that they're not normal. And I believe that they're probably looking at the data and saying that the benefits of steroids are probably going to outweigh the risks.
So what do you make of the move from the hospital to the White House in this amount of time? I mean, what would you advise a patient like this? Could he get the same level of care? Could he recover at home? And what does this mean for the people who have to be around him at the White House as more people in his circle test positive?
Yeah, so normally in this kind of a situation, you would want to complete a 5-day course of remdesivir for your average person. That would require a hospital stay. You, Elaine, and I both know that the medical equipment that they have at the White House probably exceeds that in our regular home. So I think that that's a reasonable thing to do. In terms of his contagiousness at home, that's probably something that we have to keep in mind. And wearing a mask was going to be of more importance.
Especially the people around him. You know, his own doctors say that he's not quite out of the woods yet. And speaking of precautions that need to be taken in the days and hours ahead, what are your biggest concerns as you see this all unfold? I mean, what advice do you have? Or what will you be looking for?
I've seen patients that have done very well and have turned on a corner and gotten worse. So this is something that they have to be very cognizant of. It sounds as though they are. They're looking at this very carefully, and I think they're going to make some decisions. I mean, look in the next few days for him doing well, continuing to do well. I think that's probably the likely scenario, but there's always a chance that things could get worse, in which case he'd be taken back to Walter Reed.
All right, Dr.